Hello everyone, here we are on Paris again in EuroPCR 2022, and today it was presented on the late-breaking clinical trial session by Professor Pascal Vranckx from Belgium, Hassan, an analysis from the MASTER DAPT trial showing the interaction of the complex PCI on the result of the trial. So today we have the pleasure to host Professor Vranckx, so he can introduce the trial in detail. What were the main findings that you found in this sub-study from the MASTER DAPT trial?
So, thank you for this nice question. Basically, let's start where it all started, with the parent MASTER DAPT trial. Just to recall the audience, this was a trial done in patients at high bleeding risk. They were all treated with the biodegradable polymer sirolimus-eluting ultimaster stent. And the patients were randomized 30 days after the index procedure, when they were free from an ischemic or active bleeding event. Then the patients were randomized in either one arm being the abbreviated DAPT arm, that's being 1 month of DAPT, and then single treatment, single antiplatelet treatment at the discretion of the investigator. This was compared with a more standard DAPT. This could be either 3 months or more DAPT in patients with oral anticoagulation indication, or 5 up to more months of DAPT in patients without an OAC indications. The trial was stratified, or the randomization was stratified for either acute myocardial infarction, indication for oral anticoagulation, and by site. So basically this was the background. You and I and all people working in the field, we know that more advanced coronary artery disease requests more complicated procedures, and we know that complicated procedures could translate in short-term, but also in long-term adverse clinical events. So for that reason, we pre-specified this analysis where we would liked to look into the fact if the results of the parent trial were consistent also across the spectrum of PCI complexity. So this is basically the background of the study. And indeed, if we look to the 3 primary endpoints, first NACE, net adverse clinical event, we saw a nice superimposing of the Kaplan-Meier curves across the trial, indicating there was no interaction, no P4 interaction whatsoever. Same thing was for the ischemic endpoint, even more important. So there was no price to pay, complex versus non-complex PCI, abbreviated versus more extended DAPT. There was no price to pay either in the ischemic endpoint. But most important, the message that came out of the parent trial, being that the abbreviated DAPT arm in high bleeding risk patients translated in less bleeding, adjudicated according to the BARC definitions, being BARC 2, 3, and 5. So basically indicating that across the spectrum of PCI complexity, indeed an abbreviated DAPT regimens in patients at high bleeding risk treated with this particular stent, being the biodegradable polymer sirolimus-eluting ultimaster stent, indeed translated in less bleeding. And this was the main conclusions of this trial. And this is the first prospective randomized trial giving an answer to this specific question.
Okay, really interesting results. We also have, if the audience can recall, in 2019 there was presented the global leader sub-study of the complex PCI. We got more or less the same result from global leaders, from Twilight, and now from MASTER DAPT. So I think there is a continuum in the data, and I think this can reassure to the operators and the clinicians that are treating these patients that this type of abbreviated strategies are safe and effective in this population. how would you recommend the clinicians operator to introduce this piece of information that you have produced from MASTER DAPT in their clinical practice?
Well, basically, as you indicated correctly, a major limitation from this trial is, of course, that it's done with one particular stent, the sirolimus-eluting stent with a biodegradable polymer. But, as you mentioned, there's also Twilight, and there's also Global Leaders, where I was happy to be part of the trial leadership. And we, in an analysis of complex PCI, we came to exactly the same conclusion in patients without a high bleeding risk. So reinforcing the message that we now created for the high bleeding risk patients. So I think indeed we should step away from longer DAPT in patient populations, and for the first time we established that 1 month of DAPT in high bleeding risk population is enough. Please recall that there is always, in whatever trial you do in this field, the trade-off between bleeding and the ischemic endpoint, myocardial infarction. And as we know, both weigh on mortality. So it is very important to make this trade-off. And whatever combination that we tested in the study, so complex versus non-complex, complex plus ACS, complex or ACS, we came to the same conclusion. There was a clear benefit. So the signal from harm, so the number needed to harm, was always bigger than the number needed to treat, to treat, so for the benefit. So I think that is a very important message. The consistency of the data across the whole spectrum makes that 1 month of DAPT in high bleeding risk patients is more than enough.
I think that the conclusion from Professor Vranckx are completely in line with we interview for our intervention and PCI online, Professor Vladimir for the MASTER DAPT presentation in ESC, and he said, we now should look for who we should prolong DAPT rather than who we should shorten it, because we know we have to shorten it rather than prolong it. So it has been a pleasure for me, for all the audience from AeroPCR, and for Aero Intervention, and for PCR Online, of course. We have an expert which has presented Global Leaders analysis, and then also today has presented the MASTER DAPT sub-analysis of complex PCI. So we are in the light of a very expert in the field that has proved a lot of good data. So Dr. Vranckx, many congratulations for the presentation, for all the team on the MASTER DAPT. We know that there is a lot of people involved in the trial, not only you. And for all the audience looking for us in social media, we are here live on Paris on EuroPCR 2022. We have today interviewed Dr. Vranckx, but today we will interview another people, so stay tuned with us. We will try to provide you the last data is available on the meeting, so you can search and look it in social media. So Professor Vranckx, again, thanks you for your time.
Thank you for having me.
Thank you.